So, Michael, thanks for coming on today and giving me the opportunity to be interviewed. I'm Dr. Jacob Haskalovici. I'm a neurologist and pain management doctor, pain management specialist, and I'm also the Chief Medical Officer of Bliss Health.
Wow, it's great. I have a couple of questions for you that our patients might want to hear.
Okay, go ahead.
The first question is, what is chronic pain and how is it different from acute pain?
Okay, so your question is about the difference between acute and chronic pain. That's a very good question. So, acute pain, these are actually two separate conditions. And let me think about this. Okay, um, so acute pain is the symptom of pain that is the body's response to an acute injury. So, let's say you fall and injure your leg. The feeling of pain that you're experiencing immediately after an injury is referred to as acute pain. Now, acute pain differs from chronic pain because acute pain generally improves once the body has healed itself. So the body will naturally go through a healing process after an acute injury, and once the body heals itself, the symptoms of pain should lessen or stop completely. Acute pain is the symptom of pain that doesn't seem to be, I'm sorry, chronic pain is the symptom of pain that doesn't seem to be getting better or going away. And so, after a period of time where you would normally expect the body to have healed itself, if the symptoms persist, and that depends on the type of injury that you have, but generally, sometime between 3 and 6 months after an acute injury, that enters the realm of chronic pain. So, this is a period of time where we would have expected the body to have already healed itself, yet the symptoms of pain persist.
Got it. It's great. Our second question is, what are the common causes of chronic pain?
Yeah, that's a very good question. Chronic pain is can be caused by any condition in the body where one of the symptoms is pain or discomfort. Generally, there are four major tissue types in our body that produce pain. The first is muscles. Muscle pain. Muscles, when they get spasmed, they can produce pain. The second is nerves. Nerves in the body generally transmit pain signals from the outside world into the brain. And when nerves are not functioning properly, or damaged or injured, they can produce pain. A third category is bone and joint pain. Pain coming from degenerative changes or inflammation in our bones or our joints can cause pain. There is also a fourth category of pain that is a little bit more elusive or kind of cryptogenic, and that's called nociplastic pain. That's pain that's actually produced in the brain and sending signals down into the body. There are several examples of this, including fibromyalgia type pain or complex regional pain syndrome. These are generally somewhat rarer and require a different management strategy than muscle pain, nerve pain, and bone pain.
Great. Thank you for going in depth so much. So, is chronic pain actually diagnosed?
Chronic pain is diagnosed, it's really a clinical diagnosis, which means the history alone is enough to help me categorize or define a person as having, diagnose a person as having chronic pain. So, as I mentioned earlier, chronic pain is the symptom of pain that persists beyond the time where we would expect a person's body to have healed itself from an acute injury. So somewhere between 3 and 6 months. But I'm going to add to that. Unlike acute pain, when a person is dealing with chronic pain, so symptoms that are present for longer periods of time, the pain not only affects a person's biology, so their body parts, but it can also impact their mind, their mental health, their emotional state, and also their social well being, their ability to work, their ability to interact with people, go out with their friends. And so when a person is experiencing pain for longer than 3 months and it's affecting their mood and their social well being, we generally categorize them as having chronic pain syndrome.
Great. So, what are some treatment options for chronic pain?
That's a great question. Generally, my approach is to separate different types of treatments into three categories. The first is treatments that focus on treating the body or the physical symptoms of pain. The second is a category of medications and treatments that focus on helping a person deal with the emotional burden of living with chronic pain. And the third category is focused on helping a person live better and feel better, to really address the social issues that are associated with chronic pain. When we think about treating the body, important treatments that come to mind include physical therapy, topical medications like creams and rubs, oral pharmacotherapy pills like anti-inflammatories or nerve pain medicines or muscle relaxers, and also there are some interventional treatments for pain, including injections and in some instances surgeries that can be used to treat the biological symptoms of pain. It's also, as I mentioned, important to address the symptoms of how the pain is affecting a person's mental health. And so for that category, we have a long list of treatments, including cognitive behavioral therapy. There are different forms of psychotherapy that can be applied. There are certain antidepressant medications or medications that were originally designed to treat a person's mood, but can also actually be effective in treating pain. So these are the types of treatments that we want to integrate in to address the symptoms of the emotional burden that living with chronic pain can have on a person. And finally, on the social side, there are behavioral therapies that we can help and introduce to a person who's suffering from some of the social issues associated with pain. There are, reintegration or helping a person adjust to new working conditions, for example, through occupational therapy or behavioral therapies. It's also important to do some form of talk and psychotherapy to encourage a person to, push themselves, to go out and do things that they generally love. That's sort of a combination of cognitive and behavioral therapy. And then finally, it's important for us to provide social support for our patients and really manage the disease like a chronic disease. And we can accomplish that by doing something called remote therapeutic monitoring, where in addition to setting up a person with a treatment plan that focuses on their biology and their psychology, it's important to give them a plan that also helps them with their social well-being. And we have the ability to actually monitor our patients and track their symptoms over time along with them by scheduling follow-up check-ins with a health coach or a nurse or a medical assistant or one of their doctors to check in on them monthly to make sure that they're responding well to treatments, that they're participating in their exercise program, and that they are seeing the results and the successes that they were hoping for.
Right. So, some of our patients may also ask, are there any non-medication approaches or alternative therapies that could help manage chronic pain as well?
Yes, absolutely. We spoke about several of them already, and I'll reiterate. Number one is physical therapy or home exercise programs. We know that movement is medicine and that motion of the body, of the joints, is actually lotion for the joints. So we can, every treatment plan for chronic pain should involve some form of movement therapy. And that is a non pharmacological approach. Similarly, cognitive behavioral therapy or talk therapy or remote therapeutic monitoring or digital symptom tracking, these are all different types of therapies that we can offer patients that don't involve pills or creams or anything pharmacological that can be extremely effective in the management of their pain symptoms.
So another question our patients might have related to that is what lifestyle changes could be beneficial in managing chronic pain?
There are 6 principles of lifestyle medicine that we encourage all of our patients to think about and to try to integrate into their lives. The first is movement, as we mentioned. So, exercise is a lifestyle modification that can be extremely helpful for chronic pain. The second is sleep. Uh, Practicing proper sleep hygiene is extremely important. We know that if a person has a good night's rest and that on a consistent basis, their perception of pain actually changes and can improve. And the opposite is true. A person who doesn't have healthy sleep hygiene can report higher pain perception throughout the day or week or month on an ongoing basis. The
Right.
third principle is diet. Eating healthy and focusing a diet that focuses on anti-inflammatory foods is extremely beneficial. General stress reduction is another principle of lifestyle medicine. We know that pain symptoms and stress levels often correlate very well with each other. The more stressed you are, the higher your pain perception. The less stress, the lower your pain perception. Social connections is also an extremely important principle in lifestyle medicine. Fostering relationships that are important and meaningful to you, and practicing gratitude for having these types of relationships can improve a person's overall health, well-being, and by extension, their perception of pain. Finally, we talk about avoidance of toxic habits. Excessive alcohol consumption, tobacco consumption, or illicit drug consumption. Generally, avoiding these toxic habits can improve a person's overall health and well-being, and again, by extension, their chronic pain symptoms.
All right. So our patients might be very cautious and they may want to know what are the potential side effects of long-term medication use for chronic pain.
I think that's a good question. I think it really depends on the type of medicine that a person is using to treat chronic pain. We can try to separate them into 4 categories. The first category are anti-inflammatory pain medications. Those medications are generally well tolerated. We try to avoid those medicines in people who have a sensitive stomach because they can irritate a person's stomach. If overused, they can also affect a person's kidneys and their blood pressure. These are things that we need to monitor, but not absolute contraindications to using these types of medicines. The next category of medications that we like to prescribe for chronic pain are muscle relaxers. There, the most important considerations are on a person's arousal or wakefulness. Some muscle relaxers can lead to fatigue or cause a person to feel tired or impact their ability to think clearly. So cognitive side effects, these are things that we need to monitor for, but again, rarely absolute contraindications. The next category of medications are nerve pain medicines. These are generally well tolerated medications. They could cause sedation or cognitive side effects, so it's important to monitor them. And if you have some existing conditions like kidney damage or kidney disease or a liver disease, then the levels of these medications need to be monitored. But again, generally very well tolerated for the most part and effective. And finally, there's a category of medications that are used sometimes to treat chronic pain and the mood symptoms associated with chronic pain. Those are some families of antidepressant and anxiolytic medications that can be used to treat pain. There, the side effect profiles differ and are, a slightly stronger consideration. So, for example, if a person is using other medicines for mood, we would generally try to avoid doubling up on them with a different medication for mood. There are some other rarer side effects on the heart and on other organs, but generally these medications, when prescribed appropriately for the right person, are very safe, very well tolerated, and highly effective.
Great. Another question our patients might have is, how can chronic pain actually affect their mental health, and what can be done to actually address it?
Yeah. Being in pain is not a happy state. If you think about, any injury that you've ever had in your life, you generally don't associate that with being happy. Now, when you have an acute injury, we are comforted in knowing that these symptoms might actually improve and get better. The issue with chronic pain is after several months of suffering from a symptom, the realization that you might have to deal with these symptoms for the rest of your life can set in. And that alone can be a very, very depressing idea. Think about not being able, our mind immediately starts thinking about how the pain will affect our ability to do things like work, take care of our family, earn a living, do things around the house, do activities that we generally love. And these ideas can actually lead us down what we call a negative automatic thinking, or a downward spiral, and lead to all sorts of other symptoms of depression and anxiety about the future. We know that there is a very intimate relationship between chronic pain symptoms and mood that's actually bidirectional. And let me explain what I mean by that. We just mentioned that having chronic pain is not a happy state and can lead to symptoms of depression and mood disturbances. We also know the opposite is true. In some instances, pain could be a physiological manifestation of an underlying mental health condition. And in that instance, a person is dealing with depression or anxiety. But rather than feeling anxious, or rather than having decreased energy or issues with sleep or depressed mood, which are common in these mental health conditions, instead the body chooses to manifest the symptoms of their mental health condition in the form of chronic pain.
Great. So some of our patients may be looking for additional support and might be interested to know if there are any support groups or resources available for individuals living and suffering with chronic pain.
Yeah, there are some great books out there. I think knowledge is power when it comes to chronic pain. And so this isn't a social support tool, but there are tools out there to, I always like to empower my patients to kind of take control of their pain. Pain can very quickly control a person's life. It can dictate what they do, how they act, how they live, the income that they earn, their personal relationships. And so I encourage my patients to think about pain as a passenger rather than sort of the driver of the bus. I use this analogy. There's two types of dog owners. There are owners that lead the dog. The dog stands by the owner, and the owner directs the path that they will walk on. And there are other types of individuals where the dog is actually leading the direction of the person. The dog goes left, the person goes right, goes left, and the dog goes right, the person goes right. And I
Great.
think about chronic pain in that sense. Pain can actually control a person's life. And it's important for us to be the master, where we are the ones who decide how we're going to let the pain impact our life. And so there are some great books on this, about cognitive therapy and reframing situations for the positive, not letting ourselves go down negative automatic thought patterns. So that's sort of number one. On the social support side, there are plenty of Facebook groups, there are Instagram, profiles and groups, there are LinkedIn groups, there are community groups for chronic pain sufferers, and I encourage all of my patients to go and look for these types of resources. As a matter of fact, just talking to friends and family about your life, and finding a loved one who is caring and interested in talking to you, can be a person to share your symptoms with, is also extremely important as a social support system for patients. So I encourage them to do that as well.
So you talked about some of the elements of this question before, but what role does physical therapy play in managing chronic pain?
I think it's a part of every comprehensive chronic pain treatment program. There should be a movement component to it. It's critical. As I said, movement is medicine, motion of the joints is lotion, and we know that physical activity is associated with the secretion in our brain of endogenous endorphins. These are hormones that feel good and that make us feel good, and are very similar to opioids. The same way opioids can be used to produce temporary analgesia for people suffering from acute pain after surgery, for example. Our body has the ability to produce these natural pain relieving hormones in our brain, and physical activity, especially low impact, high intensity aerobics like running on a treadmill, swimming, rowing, elliptical. These are different types of activities that can get our heart rate up without negatively impacting the joints in our body. And these produce very high amounts of endorphins in our brain and our body, which can help us feel better from our pain. So it's an extremely important part of the treatment paradigm of anyone who's suffering from acute or chronic pain.
So another question our patients might have when it comes to their health is, can chronic pain affect their sleep patterns? And if so, how could they manage it?
Yeah, chronic pain can definitely affect a person's ability to rest. At night, when we're trying to rest, our body immediately starts to think about and focus on different areas, different things that are preventing us from getting the sleep that we need. And so if you're dealing with some pain issue that is, in a dark and quiet room with your eyes closed, your mind will immediately focus on the part of the body that's preventing us from actually getting to sleep. When that's different than during the day, we often hear patients say that my pain is worse at night. That's very true for conditions like neuropathy, for example. Our patients say they get in the bed, lights are off, eyes are closed, room is quiet, and suddenly their feet start to burn and hurt. Those are symptoms of neuropathy. But during the day, when they're distracted, the symptoms are not as severe or significant, or they don't pay as much attention to it. And I think that highlights several things. Number one, how important attention is in our perception of pain. When we're attending to it and focusing on it, the perception is higher. When we're distracted, it's lower. And this all ties back into the original question, which is, if you're trying to get to sleep and you're focusing on things that are preventing you from getting to sleep, that can absolutely interfere with a person's sleep patterns. So how do we address that? Well, we try to better manage their symptoms so that they aren't dealing with the problems as much when it's time for them to rest.
So our patients might also want to ask you your opinion on if there are any specific diets or nutritional recommendations that can help alleviate chronic pain symptoms.
I think every chronic pain, it's impossible to take. It's not a one size fits all approach. Generally, there are some foods that are healthier, and there is an anti-inflammatory diet which you can we can look a person can look up. Certain Mediterranean diet, for example, has definitely some anti-inflammatory food components in it. So I encourage people to take a look at that. But I think the number one, from a nutritional and diet perspective, I think the number one thing that people can do is eat healthy, and try to maintain a caloric deficit. Weight loss, or actually, obviously it depends on a person's weight, but if you're not at your optimal body weight, any additional weight that the body is carrying around is putting excess unnecessary strain on joints and muscles and nerves. And so the lighter a person is, and the closer they are to their optimal body weight, the better that is for general health and for prevention of disease progression from things like arthritis, and other conditions that can be exacerbated by carrying around a heavier load.
Going back to a question about health that our patients might have is, how does stress and anxiety impact chronic pain, and what coping strategies could be useful?
Yeah, one of the 6 principles of lifestyle medicine is stress reduction. And we know that when a person is stressed, when stress levels are higher, their perception of pain is greater. So anything that a person can do to alleviate stress in their life can have a direct impact on their perception of pain. And that's different for everyone. If you're in a job that you despise, and that's causing a lot of stress and anxiety in your life, then maybe it's time to look for a different job. If you have many children at home, and you're the kind of person that doesn't like to ask for help, and you assume you overburden yourself when you don't necessarily have to, ask for help. If you're a person who suffers from depression and anxiety, then I recommend seeing a mental health professional and being medicated, or enter a program for psychotherapy to address these issues, to decrease stress and anxiety in a person's life.
One final question our patients might have in regards to their future treatments is that if there are any promising new treatments or research developments for chronic pain.
Yeah, there are new treatments. I tell our patients this all the time. One of the things that I hear often in the clinic is, "Doctor, I've tried it all and nothing helps me." And I'll stop them right there and I'll say, it is almost impossible that you've tried it all, because there are new drugs in the pipeline. There are different combinations of medications that can be used, and there are different types of therapies and treatments that are coming to market every single day. And at Bliss Health, we will not leave any stone unturned. If there is a treatment out there that is safe and effective, we will do our best to get it into the hands of our patients.
Got it. Thank you, Dr. Jacob, for answering all these questions. And I think our patients are going to be much better off seeing these and helping them with their progress.
Okay, wonderful. Thank you, Michael. Okay, good. That was great.
Yeah, great.
One thing I'm wondering if we should quickly do the first question again about the difference between acute and chronic pain.
Yeah, we could redo that. That's fine.
It's kind of like a little rusty.
No, it's all good. Do you want to start with the introduction again, or just the question?
Just the question.
Okay. All right. So, what is chronic pain, and how is it different from acute pain?
On the surface, the key difference between acute and chronic pain is the duration of the symptoms, but it's actually a lot more complicated. Acute pain is the pain that we feel after an injury, but before the body has had a chance to actually heal or fix itself. Chronic pain, on the other hand, is the feeling of pain that doesn't seem to be getting better or going away, and it can persist for months and even years at a time. And it often tends to impact a person's emotional health and their social well-being. So in reality, acute and chronic pain are actually completely different diseases, and they require a completely different approach and management strategy. Okay, good. I had some notes on that. I'm actually going to practice. I was going to record like an Instagram reel with that script. I had written that script, and I think it's a pretty good one. I don't know if I was looking down on it too much.
I think it was fine
for this interview, but I'm going to record it again using, I have an app that has like a teleprompter, so it looks like all my answers are rehearsed. But generally this like more natural